Greetings everybody, I'm Calvin Ward. I'm the owner of Concierge Health and Wellness Massage and Spa, located right here, 7804 Pan American Freeway Northeast Suite 2 in the city of Albuquerque, New Mexico. And today I will be walking you through some assisted stretch routines that I do with clients, as well as a comprehensive back routine that I do with clients. I'll be using some cupping, I'll be doing thermotherapy with some hot stones and applying some physical agents, and I'll be using some deep tissue techniques. Now this is a routine that's great for personal trainers, bodybuilders, athletes, or if you are a very active individual. So stay tuned. I'm doing a little traction on joints, as they say, to put a little space between the joints. Kind of get a stretch on connective tissue here for the arm. This is a good one for the chest or the pec. I'm going to lean in slowly. The patient's going to tell me when to stop. Is this good or do you need more? That's good. And then I'm going to press back. Can you feel that? Oh yeah. Good. And this is a good one for this glenohumeral joint where the pec connects up and it just opens up the chest. And I can move my elbow back and forth. That wasn't painful, was it?
It was good painful.
Okay, relax that arm out. Pec minor, I'm just going to thumb up. Let me know if this is painful or not. And how is this feeling?
It feels good.
Okay, I'm going to go in and I'm kind of moving under and just grabbing. And you can tell, you can feel that because you can see a little bit of the look on the face. But there we go. I'm just going to grab this and shake this and jostle that a little. Just doing some compression on the upper chest. This is a good area on the pec. Not a whole lot of pressure, especially when you have a nerve plexus here. This is it on the chest. So just some opening up the pillowcase, and I'm gonna pull up and back. Do you feel that on C-spine? And take breaths as necessary. And I'm gonna just move. You feel any stretches?
Yeah, good.
Nice. And then I move here. And this is just a little traction. C-spine. Open up the shoulders. And good to go. My hands and my fingers get a little bit more traction on the skin for fascia, but how's this pressure for you?
Yeah, it's good.
So I like to put my body weight here. I'm going to press down at the hip and let me know.
That's good.
And we're going to hold here. Breathe as necessary. Open up adductors. This is touching hip flexors as well. A lot of areas people don't neglect. They just don't get as much attention. And lean forward. Here we go. How? This is super tight, huh?
Oh yeah.
So your glutes in your hands could use some opening. Kick a little bit. Yeah, relax. So this is an Infinity. Oh, that doesn't come off. This is an Infinity massage gun. I'm just gonna put this real quick here. Let me know how this feels on this TFL. To kind of get. People say it loosens the muscles, but the science is the vibration is breaking up the fascia. So it helps to do percussion gun therapy before you do some stretching, or during the stretching, or after a workout, because it's also promoting blood flow. How is this feeling here? Is this painful? This feeling therapeutic? Feeling good? So what I just finished here was doing some traction on the limbs. Did some stretching. Did a banana stretch. Stretched the adductors, the quads. Did some stretching on the upper neck, reach all the muscles of the upper neck, the levator scapula, the trapezius, the supraspinatus. Did some upper chest stretches, and then focused on the glenohumeral joint for the pec. Opened all that out, and now and I did some traction on the C-spine as well. So that's the first portion. What I'm going to do now, we're going to have them turn over. I'm going to have the patient turn over, the clients turn over, and then we're going to start this back routine. Now that the client is turned over, What I like to do some compressions on the back. So I can do some compressions, and it's good to have a table you can adjust, because you can lower the table, which can control and keep my arms locked out. Now when I do compressions, I go over the upper glute, and I like to press downward and hold. And then I also like to put my hand over the sacrum and kind of press down and move that around a little bit. You have some ligaments that are wrapped around there. I think the sacrum and the fascia there in the thoracolumbar fascia is key for opening up the back. So compressions, that's done. What I'm gonna do now, I like to go to the area of the QL. A lot of people have issues with the back in the QL area. So I'm gonna go here, have the client take a deep breath. And when they exhale, I'm gonna sink in. And I'm gonna sink in this lower back area. Good on pressure? I'm going to move from here. I have this lowered a little lower because I'm doing deep tissue, so I want to be able to squat a little bit. My elbow is on the glute. Have the client take a deep breath. And exhale, and I'm sinking my body weight into this glute. How is the pressure? Good, wonderful. And I can move the elbow. Now the glute max, minimus, and medius. So what I'm going to do on the side, I'm going to take the elbow on the side, and I'm going to kind of rub up. And I'm digging into the glute, pushing up, digging down. And this should feel, now if you've worked out your glutes, this might not be, it'll feel good, but it might not be. And when I'm finished, no pain?
Good pain.
Good pain, yeah. Wonderful.
It's all good, bring it.
And I like to do that for them. And this is the glute twist. So after I've elbowed out, I'm done. So this is a glute stretch. So I'm gonna use my forearm and just kind of dig in here, and I'm just leaning up with my weight. So this is almost a position of release. You know, positional release is getting the muscles in a position where they can relax, and then you go in and work on them. But I'm just doing this. I think this feels great for the glute, and you just kind of push up. Yeah, done some stretching on the back. The massage gun I'm using should be one of the top 5. This is the Infinity, and you can get this. Costco normally has this. Costco has these jokers for $99. It retails at $300, or it's actually $389. But anyway, what I'm going to do is use a percussion gun of choice. This is a professional grade, 5 levels, especially when you're dealing with bodybuilders or athletes. And then I'm going to hit the back. I'm starting up here on the traps. Let's take it up to 3.
There you go.
Perfect. So what I do is I put an outline on the bony structures and prominences. So I'm going to put a thumb on the spine and one on the shoulder, so I know everything in between I can use with the percussion gun, and that I'm not hitting bone. And I use my hands as a guide. And I do this through the sheet, but you can actually put oil and do it directly on the skin if you so please. Now I'm going, when I hit this, and you did mention your rhomboid, so I'm going down the spine. I'm just going down the spine, and for purposes of this, I think I might do one of these. And then with some oil. This is QL area. I like to leave this here. How's this feeling here? Good. Nice. And then I hit the top of the glute. And especially for sciatica, this will feel great. Depending on the patient's pain level, this can go around to the medius. But I'm going to put this on the glute. There's no pain here?
No.
Perfect. So here, wonderful. So what I'm going to do now, of course using my hands, you get more grip for fascia. And what I'm just going to do is just press. Now I'm not doing any adjustments. So I'm just going to press. And then I can turn if I want to. And I'm just turning along spine. I could cross. I like this one better. So as a massage therapist, I don't do adjustments. However, manipulating fascia can cause people to get crepitus or bone pops. And I'm just pushing my fascia. I like to take my hands and go and push away from the spine. Good on pressure. And I'm pushing away. You can go in with thumbs, saver, and it allows you to get more traction. You're doing good.
Yeah.
Wonderful. And I like to push this away. So a lot of people like to get their back cracked, which is fine. They see a chiropractor, but you have muscles that are entwined along your processes, rototores muscles, and they wrap around. So while you're getting your spine adjusted, those muscles are going to recoil right back to the position they were in. So this here, I use a spatula when I'm using creams. This is some CBD THC cream, and this is more of a salve. You can smell this. Take a whiff. Can you smell that?
Turn it on. Kind of plugged up.
Yeah, kind of plugged up. So yeah, and so what I'm gonna do is put this on first. So what I do for the back, after I've stretched out, done some stuff, done some manual, done some movement with my hands, but without oil. Now I'm going to go in here and apply this THC cream to the back. And I'm doing this now because I want to give it time to sink in for the rest of the massage. So I apply this after I stretch. I'm just going to apply this, and I can have the client exhale, and I can just, apply the cream. And that's what the infrared and everything is for. So I'm applying the cream. Oil, I have oil. I like to use oil. Makes for a smooth transition. But these are some river rocks, so I hand pick my rocks. I don't use the base salt. These are bigger. You see my hands. And the heat, before a deep tissue, they allow the muscles to relax, promote blood flow. So I've already applied a THC salve here. And this heat, how's the heat?
Good.
This is moving heat. These rocks are warmer than normal. They maintain more heat. And this heat is going to allow or promote the absorption, of course, of our salve into the skin. And some people may say, that's a lot of oil. No, it's not actually, because when I get to working with this, it goes really quickly. I'm going to put this on the neck and I'm going to press in. How's this feeling for you? I'm going to put some pressure here and let that heat sink in. Take some deep breaths as necessary. And again, hot stone massage is relaxing the muscles, promoting blood flow. Now, somebody has their anemic, you can put these stones in their hand. Hopefully I'll lick this here in the small of the back, and then you can use the stone itself almost like a scraping tool. So I'm going to dig along this spine here. I can dig in, and you're using the heat and get in this neck. This upper trap, this supraspinatus, these spleniae muscles on the neck here. I think this feels great. The heat is promoting circulation. And that is key because it allows you, when you're doing deep tissue, to not have to work as harder. Because the heat is helping. I'll have this around the scapula here. I'm just going to. Alright. Alrighty, so I have stretched out the back, applied the CBD THC, did some hot stone massage, and now the last thing, and did some deep tissue massage. So the last thing I'm going to do is going to do the cupping. I do the cupping last because it leaves welt and it's not good. It's a little bit different trying to get over the welts, but I do it last because it's detox. It just feels great and it's a nice way to end the massage. So stay tuned. Alright, now when applying cups, I like to apply cups on the trap. You can apply them along the neck, the trap going all the way down the spine, on top of the glute, the upper glute, area of the QL, the paraspinals, and the trapezius. And then also at times when people need to, and you might not see this a lot, but you can put this, I love it. It feels absolutely great. You can put this directly on the spine. It opens up the spine. So what I'm going to do, I'm going to start placing these. So I have a cup here. I'm going to place the first one, and you can get these at various sizes. I'm just going to do maybe 5 and ask the client, how do you feel? Is that good, or do you need more pressure, or how do you feel? Okay, so that's 5. So I got a good amount. I'm going to go close. This one I'm going to put on the rhomboid. doing 5 pumps. And then I'm going to continue down the paraspinals. I'm going to balance this off. So if you don't have that many cups, you might want to try to do this and make it even in case you run out of cups. This is 5. I like cupping because you can look at where the blood is going. I say the tissues are thirsty when they turn very red, but sometimes it helps you get an idea as a therapist where you need to concentrate. You're still feeling good? Make sure you explain to the wife. Alright, so I'm finishing up putting on the cups here. The purpose of putting on the cups, it raises the tissue up maybe 2 to 4 inches depending on the pressure you use. I'm using manual pressure here, and so what that does, it forces blood up into the tissue, which means if you got an area that's not getting blood flow, it's feeling tight, this forces the blood up with the nutrients, of course, red blood cells, oxygen, everything you need for that area, and it's sending it what it needs. Right, so, and it's also a method of detox. I think a contraindication of this is if you have anemia, because you're getting a lot of blood that's pooling up in one area. It might make people feel a little bit nauseous, but this is also a detox mechanism as well, so you might feel nauseous anyway. Then when you look at the cups, there are different colors. So if you look at it, I have the same amount of pressure, but this is not as red, right? This is super red, and you can see the different colorations going down the back. So this detoxes, this opens up the tissues, good for breaking up scar tissue, good for treating tight areas, and this is just the static cup treatment. You got dynamic cupping where you can use these actually 1 or 2 presses. You can actually glide with these, or you can use silicone cupping, which you can do as well for people that don't like to leave the marks. So these marks will stay on your back for maybe 7 days, 7 to 2 weeks. So you're a bodybuilder, you need to do this. I always suggest get it done maybe 2 weeks to 30 days before you have an event, so that these spots will be gone. But then I put these on. I'm gonna leave these here for about 5 minutes. So not longer than 5 minutes, but you can leave these here for 5 minutes. Let it go. This is also a perfect time to use some red light therapy if you have it. So this will be a perfect time. That this is a red light therapy for those that don't know what it is. Now I have this here. I'll just pull it over. This is actually a great time to use red light therapy, because what you can do is red light therapy helps to create collagen, reduce inflammation, and reduce pain. So this is a great time to do it. I got 2 lights. You can put them here. So while you're getting your cupping therapy on, increasing that blood circulation, helping to release, then you're getting that red light therapy to actually work on the skin as well to help produce more collagen and help release or reduce inflammation. And another method of this, you can also do it along the spine. I think it feels great when you do this along the spine, and I can demonstrate that as well. But I think this is great because it opens up the spine, those rotatorians, all those muscles that entwine around the transverse processes of the spine, and those deep rotators. So that's about it. And I end the session with cupping, do some effleurage on the back and let the client relax. And this is the last thing that I do. For this treatment, apply some THC in the beginning to let it soak in, apply some effleurage, then did some thermotherapy with some hot stones, so it allows that THC to, it helps that THC to get more absorbed into the skin. And then after that, I did some deep tissue. And in the beginning, of course, the stretching and traction, applying CBD, thermotherapy, then did some deep tissue work. And then after the deep tissue work, for me, I applied this cupping last, because I think it's best for the, for the client and how they feel. And then again, add on. You can add on the red light therapy. Some people do the heat. You can have a hot bulb, you can have a TheraBulb where you have the heat coming down on the back to help for circulation and all that as well. But this is the back treatment in a nutshell. Did some stretching for the client, turned them over, and that was that.